Hello, and thank you for the opportunity to present my research. Enhanced recovery after surgery pathways can help facilitate same-day discharge. To date, there is little research to support same-day discharge after minimally invasive sacral colpopexy. Two retrospective studies support the feasibility of same-day discharge and revealed no differences in healthcare resource utilization or complications compared to standard of care discharge. In a study by Lloyd et al., same-day discharge was achieved in 80% of patients. To our knowledge, no prospective studies have investigated a role for same-day discharge after sacral colpopexy. The objectives of this study are to compare the incidence of adverse events and postoperative healthcare resource utilization in patients following a same-day discharge protocol compared to routine care, and to determine patient satisfaction with same-day discharge. This is a prospective cohort study of women undergoing a minimally invasive sacral colpopexy by female pelvic medicine and reconstructive surgery specialists at our tertiary care center. A prospectively collected historical control group who underwent the same surgical procedure by the same surgeons as part of a randomized control trial was utilized to compare perioperative outcomes. This study was approved by our institutional review board. Participants were identified by the primary surgeon when the decision was made to proceed with surgery. A chart review was then performed to ensure that eligibility criteria was met. This included age 18 to 79 years old, preoperative ASA grade 1 or 2, caretaker present for at least 24 hours postoperatively, surgical start time prior to 1 p.m., and ability to speak and read English. Patient characteristics and perioperative data were obtained through the electronic medical record and direct patient inquiry. The Quality of Recovery 15 is a scale utilized to evaluate surgical recovery. A visual analog scale was utilized to evaluate pain, and satisfaction was assessed with a survey using Press-Ganey type responses. To facilitate same-day discharge, the following paradigm was developed. At the preoperative visit, all postoperative prescriptions were provided. In addition to the standard preoperative surgical counseling, a novel patient education video created for this study was shown to all patients. Post-op, an ERAS pathway was developed for preemptive analgesia, postoperative nausea and vomiting, fluid balance, and postoperative oral intake. Postoperatively, patients were discharged if they met all postoperative milestones. Within 24 hours of surgery, patients were administered the Quality of Recovery 15 and visual analog scale for pain, and asked about any healthcare resource utilization since discharge from surgery. At approximately 6 weeks postoperatively, which is the traditional time for our postoperative visit, the Quality of Recovery 15 and visual analog scale for pain was administered, and patients were again asked about any healthcare resource utilization since surgery. The electronic medical record was also reviewed for patient phone calls, unscheduled office or emergency department visits, and hospital readmissions. A sample size of 47 patients was determined using published data on serious adverse events after sacral colpopexy to provide 80% power, a significance level of less than 0.05, and account for a 3% dropout rate. During the study period, 115 patients were screened for participation. 60 were ineligible, 2 were unable to be recruited, and 1 declined participation. 52 patients were recruited. However, 5 were subsequently excluded for the reasons listed here. In total, 47 patients completed the study. Same-day discharge was achieved for 37 patients. Indications for overnight observation were 5 patients did not meet postoperative milestones, 2 were converted to an open procedure, 2 had intraoperative bladder injuries, and 1 had a late surgical completion time. To address our objectives on perioperative outcomes, we compared same-day discharge cohort with historical controls. Patient characteristics of the two groups are shown here. Patients were a mean age of 62. and the majority were Caucasian, overweight, and had stage 3 prolapse. Characteristics of the groups were similar, except ASA score and previous hysterectomy were higher in the historical controls. Regarding perioperative data, more women in the same-day discharge group underwent concurrent hysterectomy and midurethral sling. Estimated blood loss was significantly greater in the historical controls, but still less than 100 milliliters. Length of hospital stay was double that of the control group. Comparison of healthcare resource utilization revealed significantly fewer postoperative phone calls in the same-day discharge group and no differences in the number of unscheduled office visits, emergency department visits, readmissions, or serious adverse events. Now I'm going to transition to sharing data on patients who achieved same-day discharge compared to the 10 patients who required overnight observation. The only difference in patient characteristics between the two groups was a significantly greater number of diabetic patients in the postoperative day 1 group. Comparison of perioperative data revealed significantly greater blood loss, as well as longer surgical case time and length of stay in patients requiring overnight observation. Interestingly, there was no difference in the quality of recovery 15 and visual analog scale scores between the two groups. There were no differences in the number of postoperative phone calls, unscheduled office visits, emergency department visits, hospital readmissions, or adverse events. Quality of recovery 15 and visual analog scale scores at 6 weeks did not differ between the groups. All patients reported high satisfaction with their overall surgical experience and perioperative education received. The majority of the patients in the same-day discharge group would recommend same-day discharge to family and friends, regardless of whether or not same-day discharge was actually achieved. Study strengths include that it is the first prospective study evaluating same-day discharge after minimally invasive sacral colpopexy. All surgeries were performed by board-certified FPMRS specialists. The historical control group was well characterized as part of a randomized control trial, and ascertainment bias was minimized using a reliable electronic medical record and direct patient inquiry. Limitations include those inherent to a non-randomized study. Broad application of our findings may be limited due to our homogeneous patient population. Lastly, our satisfaction survey tool was not validated. In conclusion, nearly 80% of women undergoing a minimally invasive sacral colpopexy on a same-day discharge protocol went home as planned. There was no increase in adverse events or postoperative healthcare resource utilization. Lastly, patient satisfaction in the same-day discharge cohort was high, regardless of whether or not same-day discharge was achieved. For those who may be interested in our patient education video, you can find it on YouTube by searching "What is sacral colpopexy" or following the link shown here. Thank you, and I welcome your questions.